Coalition for Oral Health, and we are so glad that you have joined us today. This is our 6th year of offering virtual meetings. So we were doing this before it became the cool thing to do, mostly because we understand it's difficult sometimes to make a trip to attend an all-day meeting in person, and then, of course, particularly during the pandemic. So we're happy to offer these brief updates on our coalition work twice a year. As always, the meeting will be recorded and shared on our YouTube channel, so please feel free to share the link with others after today. Some housekeeping as we get started. All lines have been muted by us to keep the background noise to a minimum. You may type any questions that you have into the Q&A box, which should be at the bottom of your screen, a little black bar, and you can use that at any time during the presentation. We may grab some questions as they come in, but if not, we will answer them during some Q&A time at the end. If you have any technical questions or issues, please type those into the chat box, and Amy will take care of that for you. For those who are joining by computer, you'll have the opportunity to participate in some polls that we're going to put up periodically throughout the presentation. And if you're just joining by phone and unable to see the slides right now, I would just encourage you to go back and review the recorded video at a later time. We're going to send the link out for the presentation directly to all who participate today, as well as the slides by themselves as a PDF, so you'd be able to click on any active links. So with that, let's go ahead and get started here. I do want to just take a minute to talk a little bit about what PCOH is and what we do. Many states have developed oral health coalitions over the last 20 years. Some have been around even longer than that. The role of an oral health coalition is not centered on a certain type of health provider or specific policy goal, but more of a broad spectrum collection of groups and individuals who are passionate about oral health, and we help connect them to share ideas and work together. We also play a role in initiating new projects and programs, even doing the work ourselves from time to time. Pennsylvania is really happy to be part of the American Network of Oral Health Coalitions, which is a national network of similar groups. And our participation with that group allows us to learn from what other states are doing, and sometimes even to learn from mistakes and issues that they have. Our coalition was incorporated in 2016 with the addition of staff and a more formal board structure. We are a registered nonprofit with the state of Pennsylvania, and we rely on grants and donations to complete the bulk of our work. In just the 5 years since incorporating, we've grown to nearly 900 stakeholders across the state, and we do have 4 full-time staff. With every staff person and every stakeholder that we add, their background helps to contribute to our reach and our knowledge base, and for that, we're extremely grateful. The connections that we are able to make around the state mean that no one has to recreate the wheel, and we continue to all learn from each other. So to start us off this afternoon, I'm going to invite our board chairperson, Dr. Deborah Polk, to say a few words of welcome to everyone today. Dr. Polk?
Thank you, Helen. Yeah, so I would like to welcome everybody who is here. Thank you so much. Just want to say that we're really glad that you are here and rooting for oral health and trying to figure out how to make oral health better in Pennsylvania. I'm excited because I think that we are starting to open up again, and so there will be more opportunities to actually get together in person. And I think Helen is going to be talking about those during the presentation and at the end of the presentation. So it's really, really nice to be able to say that I hope that I see you soon in person. Thank you.
Great. Thank you, Dr. Polk. PCOH is very lucky to have such a wonderful chairperson for our organization. We really enjoy all of Dr. Polk's insights and the work that she does working with oral health. So as we get started, just want to do a first quick poll. It's the same question we always ask if you've joined us before. And you guys should see a question pop up on your screen that is simply asking, have you attended a PCOH event before? You know, please answer the question if you're able to, if you're joined by computer. We're still a fairly young organization, so it's really important for us to give some background on what we're doing, and we want to know, who's new to us and who's been around a little bit. So we'll give you about 10 more seconds on the poll, and just want to extend a thank you to Amy, our staff member on the back end, who's working her magic on this. Okay, so it looks like we've got final count of about 80% of you have done some kind of PCOH event in the past, and about 15% are brand new to us. So the remaining don't remember, which, after COVID brain, I completely understand that. So thank you guys so much for that. We've got the poll up there now. And okay, so we've got those newer folks. The next slide or two, for those who've been participating with PCOH for a while, may seem a little repetitive, maybe just familiar, but we do have some new folks, so I just want to give a tiny bit of background on the organization. So when you attend a PCOH event or you reach out to us about an issue or concern, these are the folks that you're going to be talking to. And I wanted to just give everybody a little update, because as our staffing changes, I want to make sure that everyone is connected to the people that they should be connected to. Mary Lynn handles the bulk of our fluoride and our dental sealant work, as well as taking care of our development and fundraising. Angela is our newest staff member who coordinates our nicotine and tobacco education work. And we've recently added some dental workforce programming to her roles. And then Amy does all of our communication and event planning, as well as about 100 other things that keeps us moving forward. So our individual emails are hyperlinked into the slides. So you are actually able to, when you get the PDF, you can reach out, contact us at any time. And I should also mention that PCOH really relies on a number of students each year to help support our work. So if you know of any students that are looking for internships or school projects, please feel free to connect us, because it's through their volunteerism that we're able to stretch the work that we do. For those of you who've been around a while, this slide should look very familiar. We've got the main focus areas of the coalition listed here. We are generally working on workforce, policy, improving the oral health for our most vulnerable populations, and then community water fluoridation. Those would be our four main focus areas, and they've been our priorities for a little bit of time. So as we move forward with the discussion of the work we're taking on in 2021, I just want to point out some of those items will include the work that's done more internally by PCOH staff and board, but all of our work is collaborative. So we work to improve oral health in the state, and we want everyone to know the most recent updates for the work going on. So if you hear of something that we talk about that interests you, let us know. We'd love your help. That could include just sharing our resources, checking in with staff member to tell us what's going on, or actively joining a task force or work group. So if there's anything mentioned today that you're interested in learning more about or knowing who the lead organizations are, please just ask. And it doesn't have to be today, it can be tomorrow or next week, but we're always interested in connecting. So lastly, before we get into the work we're doing this year, I just need to recognize how fortunate we are to have a lot of support from many corporate and community funders. PCOH is a registered 501c3 nonprofit, and we're happy to report that 86% of all of our funds raised in 2020 went directly to programs and program administration. So that's either for programs that we provide directly or through our partners and subcontractors. So many of our programs use federal and community grants, but we also do rely very heavily on our corporate and organizational and individual funders to keep us moving. Many of our funders have been providing annual support for many, many years, and we really couldn't do it without them. So that includes the big names you see on this slide, but it also includes all of the individuals who contribute annually during our appeals. And you can see that list in our annual report that we publish every year after the first of the year. So we'd encourage everybody to visit our website, where you can click directly on our funders and learn more about them. We've got live links on the website directly to their sites, so you can kind of gather all the information you need. And on behalf of the board and the staff of PCOH, we really do sincerely thank everyone who's contributed to our work. both for this year as we all recover from the pandemic, but also all of our past donors who've helped build us to the strong coalition we are today. If you're interested in learning more about sponsorships or making a personal donation, we're happy to discuss that with you at your convenience. So as we begin to talk about our work, I want to remind everyone that we're just providing today a small picture of everything that we do. So I tried to pick some different things that maybe we haven't talked as much about in the past and some of our newer projects to highlight today. But we would encourage you again to reach out to us, ask questions. If you have your own ideas, anything you see us post about, we would need so much more time than this hour to talk about all of our programs and initiatives. So the biggest issue that we're discussing and working on right now is around oral health workforce. Like many professions and businesses across the state, our COVID-19 pandemic has hit dentistry and oral health care pretty hard, which is leading to problems in people accessing care. So you look at the statistics here, and obviously most of you know that we have 3 full-time dental schools. Our State Board of Dentistry licensure list contains more than 9,200 dentists in the state, as well as over 800 direct access dental hygienists. In Pennsylvania, those are called public health dental hygiene practitioners. When we look at that list a little more closely, though, we find out that some of those licensees may live out of state, may have been retired and maintain a license in Pennsylvania. And what we discover when we dive in a little deeper is that, only about 7,700 of those dentists practice or reside in Pennsylvania. So that means that, residents on paper should be able to find one of those 9,000 dentists, but often they're not able to connect with that dental provider who can see them, maybe see their child at a certain age, or participates with their insurance. One other just quick fact that I don't have on the slide, but I think is kind of interesting, is that when we look at those 7,700 dentists living in Pennsylvania, if we go back to see who graduated greater than 35 years ago, because we know we have an aging workforce. So when we take out and look to see how many graduated dental school over 35 years ago, that is 30% of those 7,700. So we definitely have a workforce that is we'll say ripe for retirement. Even though I know many dentists are practicing probably, more often than you would think, because they do love their jobs and they love their professions. So to collect some additional info on this expected dental workforce, in 2021, PCOH is now contracted with the Health Policy Institute of the American Dental Association to produce a report that details out an outflow and inflow analysis of the dentists in our state, as well as projecting out the workforce that's going to be practicing over the next 20 to 25 years. The preliminary draft, which we just received about a week ago, shows that we should expect a decline in the number of practicing dentists available to the population through 2035. For specific populations like rural communities and those served by Medicaid, we are likely going to see an even bigger gap. So with that, we've invited the Health Policy Institute to present their findings during a webinar at the end of this month. And when you receive the slides, you'll have a link to the registration. So we encourage everyone to consider attending. The full published report is about 115 pages, so it's a pretty lengthy one, and it'll be available after that date. So we're happy to share it with everyone once it's in final form and we've had that webinar presentation. Another way that we collect data on our workforce is through licensure renewal surveys. The Department of State in Pennsylvania asks each renewing healthcare worker to answer practice and demographic questions at the time of their renewal. So for dental, that time frame is every 2 years on March 31st. Pennsylvania is unique in that we basically require our providers to answer these surveys. So we've got a really great representative sample to pull data from every 2 years. The Department of Health used to have dedicated staff that would analyze these surveys and put out an extensive report called the Pulse Report. But staff cuts have made that a little bit more difficult in recent years. So we're now working with the State Oral Health Program to, review and publish findings since the last formal report, which was actually based on 2015 data. And our goal for that is to have some info to share publicly by this time next year. The last bullet on this slide just provides some basic provider to population ratios that we're tracking. For urban counties, there are 55 dentists per 100,000 people. So that's like the standard, ratio that we would want to look at. When we look at just rural counties, that number drops to 36, which is a pretty significant drop. And then lastly, that number 20, that represents the number of dentists to 100,000 people in our 4 most rural counties. So looking at, the access might be reduced as much as 2/3 when we get to a rural county. Many of you may have heard that expression about your zip code determining your health status. And this can really be especially true for dental. We see that in these numbers. So it's something that we're extremely concerned about and we continue to monitor. Next up, when we look at these population to provider ratios, they're also used by the Health Resources and Services Administration, which you guys probably know as HRSA, to determine dental health professional shortage areas. And those are based on if there is less than a 1 dentist to 5,000 people ratio. So we've seen some improvement in this area over the last few years. The most recent report was just released like 9 days ago, so it's linked right there. You can get it yourself from the slides. And we still see that Pennsylvania needs nearly 300 dentists to fill the gaps. So we continue to know that there's a shortage of dentists in some areas of our state. One program that's worked in the past and continues to work somewhat to address this problem are the loan repayment or loan forgiveness models, which really are used to entice dentists and hygienists to practice in the DHPSAs, the dental health professional shortage areas. As of last summer, we currently have 25 dental providers participating in our state's loan repayment program. 18 of those are dentists and 7 are dental hygienists. But unfortunately, the funding and the availability of these positions isn't enough to make a dent in the need. There are always more applicants than there are, open dollars to spend. We're also pretty concerned that COVID's going to have some long-term impacts on dentists, whether they choose to retire early or practice less hours, or we're starting to see a lot of hygienists and dental assistants and office staff leaving the field altogether. So we're hearing that from a lot of offices and safety net clinics all over the state, and we're continuing to try to monitor different, programs and things that we could implement to help. So what else are we doing about this? It isn't just a number of straight providers, it's also about strengthening our existing workforce. So over the last few years, we've had over 1,800 dental providers take continuing education courses with us and our partners. All of our courses are offered free of charge. We get the funding through grant dollars, and we continue to offer them even past the time of those grant periods. Most recently, we've added some courses on training dental providers to offer nicotine and tobacco cessation counseling, and medical assistance now pays for this service once the training is documented. We're also focusing on getting more providers to see patients with disabilities. That's been a really big issue for a long time. And we've got 5 hours of free CE available on this subject on the website, including some clinical information as well as just data around the need for patients with disabilities. And we've developed some materials that providers are able to use, FAQ sheets and intake forms. But what we really want to do is strengthen the existing workforce to be able to grant more access. We're also really excited to get back to exhibiting at conferences this year. And we're working with certified school dental hygienists in 30 school districts across the state to offer materials to them as well. I think that, those are all things that we're trying to, as I said, strengthen the current workforce. So as we move on and we start talking about the other ways that we can add dental providers in underserved and rural communities, is that we've got to try and build up the pipeline of providers coming up through local school districts and colleges. We know that the best chance we have to recruit people in specific communities is to find people who may want to practice in their hometown. So in order to do this, we try to reach dental and dental hygiene students while they're in their programs, to encourage them, not only to stick with dentistry, of course, but also to consider careers in public health. Oftentimes, these students might be more concerned or may only be thinking about private practice or academia. And so we want them to think about public health as an option, which may work for them. Through our state's HRSA oral health grant, PCOH does use Mary Otto's book Teeth to discuss various public health careers and the history of dentistry. Since September of 2018, when we started that project, which is hard to believe that was almost 3 years ago, we're really happy to report we've worked with more than 75 faculty at dental schools and dental hygiene programs, and we've also been able to have one-on-one interaction with over 700 students. Our survey data demonstrates so far that a higher percentage of these students are now more likely to work in public health, which makes us very happy. So if we look deeper into the pipeline, we begin to talk about high school students, right? So that's the next step down. We start with the college, now we go down to high school. In the last few years, we've started to work with a group called the Health Occupation Students of America, or HOSA, which has about a dozen oral health programs in PA. Because of COVID, we've added a slightly different model of presenting info about dental career students. And we've now started working with the area health education centers, who host a variety of regional career academies and health career fairs. So we're able to talk one-on-one with students at the high school level who are already interested in health careers. We're also building a database of the career counselors at the school districts, specifically those located in those dental shortage areas, and we're sharing resources with them. So we've got, DHIPSA maps, we've got the list of the schools that offer dental and dental hygiene programs, which there's only 15 in the state, and we've created a dental careers pathway document, which lists out, sort of the main responsibilities of dental careers, the salary expectations, and the idea is that it's going to spark interest in people who maybe are already looking sciencey, health-wise, that might start thinking dental. If anyone in the audience today is looking to use some of this information, it's on our website, and we're happy to share copies with anyone if you want to share it with youth and adolescent groups in your communities. So if you work with the Scouts or a youth Rotary Club, anyone who might be interested in pursuing dental careers. And then lastly, another new project we're working on in our pipeline work is really investigating our state's Department of Education requirements for career planning. So they have a Future Ready program where all districts are now required to offer a various level of career info at specific grade levels. And so even starting as early as 5th grade, the schools are required to talk careers in some way, shape, or form. Obviously, we're not handing them, a college curriculum at that point. But we'd love to be able to see some of these schools in underserved areas to start talking dental as early as 5th grade. So that's something we're going to be working on into next year, and we're really excited about that. So moving on to our next priority, community water fluoridation, which is, of course, one of our favorite things to talk about. And our work has mostly been centered around a few areas in the past few years. We do a number of grants, which have been made possible through our state CDC grant, and we were able to use some additional funds this year to provide over $50,000 in equipment replacement funds to 4 different public water systems. And that will guarantee that they will continue to offer optimally fluoridated water to their customers for the next 5 years. We've got additional grants available in the next year or two. If you know of any water systems that might be considering adding a fluoridation system, please let us know right away and we can help provide some information. Our second main focus with community water fluoridation is watching for rollbacks. So rollbacks are what we call it when a system is currently fluoridating but considering removing their fluoridation system. Each year there's at least a few that pop up, and we rely on our water fluoridation task force to sort of help assist us at that local community level. And we're really fortunate to have some super passionate and competent folks in a lot of communities across the state who will speak up for fluoridation as soon as they're needed. And we've also worked with the State Department of Health and their oral health program on a communications campaign that last year was offered to highlight the 75th anniversary of community water fluoridation. It was run through internet ads and postcards and items that were distributed directly to communities. And we targeted counties that have had rollbacks or had threatened rollbacks over the last few years. We're continuing this campaign into 2021 with the Department of Health. And we're super excited to see them work on this over the next few months. And the ads are even going to be a little wider even this year. So even in some of the targeted counties, there'll be some community water fluoridation ads on things like the gas station TV. So if you guys have ever gone and pumped gas and saw the little screen with the ad, we're going to have promotion for water fluoridation there, which I think is just really great. So data tracking and surveillance remains a really important part of our fluoride work. So when we start to look at what does Pennsylvania look like, and I credit a lot of this both to our partners at the Department of Health and to Mary Lynn here at PCOH. She's really an expert in analyzing and understanding all the infrastructure of community water systems. And she's kind of helped to crunch some of these most recent numbers. So, when we look at the state, we know that we've got over 2,000 community water systems to serve, our 12.8 million people. And that's a lot. There are states that have maybe a few hundred. And so when each of those water systems gets to make their own decisions on whether or not they're going to adjust fluoride, it puts a lot up in the air and a lot of room for wiggling. So when we look at this, we would start by excluding the households that are served by wells. So that top percentage, that 55%, those are people who are actually served by a community water system or a public water system who are receiving the benefit of fluoridated water in our state. So we're at 55% there. The second statistic looks at the total population of the state. So the whole state, including the 1.5 million people who get their water from a private well. So our 2020 estimate for this group is about 49%. Both of those statistics are a pretty far cry from the goal that has been set by the United States for the 2030 Healthy People objectives. What they would like to see is that we reach 77.1%. So we've got 9 years to do that. And so that's a lot of work to be cut out for us there. So regardless of how it's calculated, Pennsylvania really does remain in the bottom 10 of the 50 states when ranked in population receiving fluoridated water. Our neighbor to the south, Maryland's got over 93% of their population on water systems that's getting fluoridated water. So we've got a long way to go, and we hope that all of you can help us promote these benefits as you're going out and serving different community organizations. And lastly, on fluoride, one of our biggest successes in 2021 has been the completion of our mapping tool for Pennsylvanians to use. This map, and again, it'll be linked in the slides that you received, so you can go right to it. The blue shaded areas are demonstrating the areas of the state that have fluoridated water, and the red would be areas that are not. So it's really nice. It allows an individual to put their address right into the search bar and find out if optimally fluoridated water is offered by your local water system. We did rely on a number of partners to complete this work, including the University of Pittsburgh Water Collaboratory and the Dental School, as well as a really wicked smart student from Mercyhurst. Because I don't know about you guys, but GIS mapping is not anything I ever learned. So the map is live on our website now, so you can go in and check it out. And it's going to be regularly updated. So we're going to be looking at the back end of the map on a regular basis, using the information that we get from the Department of Environmental Protection, as well as the information that we get from our stakeholders. So this is an adjusted map where we go in and we will physically adjust systems as they change. So that means we need you to let us know if you find an error or if you hear of a community talking about changing their fluoridation status. So with that, we'll move on. So the other, major issue that we talk a lot about is data collection and surveillance. And I always talk about, if there's no data, it didn't happen. And of course, there's a very famous quote about without data, you're just another person with an opinion. And we've all certainly got lots of those. So we want to make sure that we are using data to inform our decisions. And, if not, we really run the risk of wasting resources. And for those who work in nonprofit worlds and government worlds, we don't have resources to waste. So let's make sure that we're using the most accurate data we can to determine where we're heading. So we want to make sure that we're not just picking our programs out the right way, but we're also evaluating the success of those interventions. And again, just have to mention that our Department of Health Oral Health Program recently set up a surveillance system with really great key indicators. We actually have 42 oral health indicators that we're now tracking. And we're continuing to monitor those changes. So as oral health status in our state changes, we can actually watch that happen and see where our needs are. So still a work in progress, but there are data now available, which is pretty exciting. One way that we measure the progress on this data is to use a state level oral health plan. So PCOH serves as a subcontractor under the Department of Health's oral health program to help track and monitor our progress for the plan. If you haven't had a chance to read through this document, I'd highly encourage you to do so. I promise you it's only like 20-some pages, so it will not take you too long to peruse. And it was developed with a lot of input from oral health stakeholders all across Pennsylvania. So we think it's pretty comprehensive. And the 3 priorities that were identified by our stakeholders are listed here. Of course, access, prevention, and education, and there's so much overlap between those 3 things that they really do go hand in hand. Looking at oral health workforce, and then looking at the infrastructure of the state, making sure we're tracking things appropriately. So within those 3 priorities, we've also identified 22 measurable outcomes, and those would be key data tracking points that we can actually set goals for. So as I mentioned, there's 22. I only listed a couple on the slide here just to give you an idea of, what we're going to be looking at, what we're going to be measuring. But the plan and the picture of the plan there is clickable. So when you get the slides, you can actually click right to it and view the entire document, check out all those measurable outcomes. And we're finalizing all of our baseline statistics right now for the 2020 year so that we can then set our goals for, probably some short-term and long-term goals of what we want to accomplish by 2030. So really, really exciting. I've listed here as well a few of the resources that we use. What we've seen used nationally by our country, and then what we've used in our state to look at oral health status. So the first kind of one that pops up here is the PRAM system. That's a survey that's issued to a sample size of pregnant people every year, and there are some oral health questions in there. So one of the biggest kind of oral health questions that we look at and we track is, how many of you had your teeth cleaned during pregnancy or during your most recent pregnancy? And what we have found is that only 51% of those people are reporting having their teeth cleaned during pregnancy. Something that's not on here, but I also think is really interesting, is that when we ask a similar question around oral health and we say, did you know it was important to see your dentist and have your teeth and your oral health maintained during pregnancy? 90% of the people said yes, they knew it was important, but only 50% are actually seeking care. So I think that's a kind of shows where we have some problems. It's not necessarily an education piece. It may be more of an access piece. Likewise, the next thing that we look at is the behavior risk factor surveillance system. That's a national set of questions, but asked at our state level. Certain questions are asked at certain time points, every 2 years. And one of the things that we look at is, not just the percentage of people visiting the dentist. I can tell you that the 2018 numbers showed that only 69% of adults in Pennsylvania said that they visited a dentist in the last year. Again, not a great statistic. And then likewise, we see 45% of those adults, everyone who gets this survey, have also said that they've lost at least one permanent tooth because of tooth decay or gum disease. So that's not counting wisdom teeth. That's not counting trauma or anything like that. That's actually because they had dental disease, they lost a tooth. So, we track those numbers pretty carefully because they are what we have. So, we'll continue to monitor those numbers and those trends. And then lastly, a question that pops up quite frequently is how much decay do we have in our state? How many kids have had dental decay or cavities? And we really don't have a great answer for that. We did a screening survey needs assessment back in 1999, which was not an officially recognized CDC basic screening survey. But we are planning to do that official basic screening survey this upcoming academic year. So that will actually be a hands-on check of over 8,000 third graders across the state. They're all pulled from a specific sample. So we'll have a representative sample of the whole state. And we're going to go out and we're going to find out how many kids have decay. We're also going to find out how many kids have had fillings. And we're also going to find out how many kids have urgent needs for dental and how many have had dental sealants on their first molars. So a lot of really, really good data that's going to be coming into our state here in the next year. And we really look forward to sharing that information with you as it's available. So kind of hand in hand with some of that discussion is, what kind of community support do we need? What's the oral health literacy of our population in the state? So over the last few years, we've worked with a number of organizations, and I'll name a few and I'll forget people and I apologize, but when we talk about like the American Academy of Pediatrics, the Head Start, WIC, the Office of Rural Health, all of these different groups that do so much good work and really do reach people. We've got to get to where they are. So that's one of my favorite things to say is that, it's not one of those, if you build it, they will come. That is not what happens in oral health. You have to build it and take it to them. And so that's something that we try to do is we may not always be able to get directly into communities, but we try to offer as many resources and connections that we can to allow you all to do your work as you work specifically with the community. So, we add a few more programs every year. We do a little bit more in terms of materials offered. And one of the things that we're going to be launching, and we just actually started, was that, since COVID began, we've seen an increase in the number of dental access stories that we hear. So, someone calling up and saying, this is my problem, I can't find a dentist who takes my insurance, or, my 1-year-old has a problem, but the dentist won't see them until they're 4, all kinds of different access stories that we hear. And we hear them from community support organizations, and then we also hear them directly from affected people. So what we're doing is we just started a story bank, and our goal is to get 67 stories from all 67 counties of issues that are kind of popping up. And we know, again, that these have increased since COVID began. So the link will be there. If you're able to share that link out in your community, if you're on a county level Facebook page and you want to post it, we have had it in our newsletter, and we want to try to collect as many stories as possible. These would be anonymous stories, so nobody has to share their name. We're not going to be using names or anything like that. But we really think it's important to tell the story as we start to advocate for changed policies. Something else you may have heard of is the YMCA Health Equity Tour that's taking place right now, started back in June, I believe. And they're going around to all 67 counties in the state, and it's really like an amazing health fair. It's helping people connect with insurance and health resources. There's physical activity, nutrition, just a whole bunch of really good information that's being supplied directly to communities. So we were able to work with our partners at the American Academy of Pediatrics and supply oral health materials for their tour. So as of last week, I believe they've reached over 1,000 adults already. And, we've got some really cool materials that are patient education brochures, We've got the puppets and the tippodonts and all of the stuff so the kids can get engaged. And even talking about things like the acidity of drinks. So we have a little pH testing kit that they're doing right in the community with the families. So we're really excited about that project, and we hope to, I think the goal is that they're going to reach somewhere around 12,000 people across the state. So that's going to run through early next year by the time they hit all of the different counties. And then lastly, one other project that we completed this year was, 2 separate flyers really focusing on increasing water consumption for kids and decreasing the sugar sweetened beverage consumption, because for all of the good that we're doing in terms of getting kids to the dentist and, brushing and knowing what to do for their teeth and fluoridated water, so much of that is counteracted by the increase in sugar sweetened beverages. And not just sodas. We used to talk sodas. Now we talk about energy drinks and the sports drinks that are out there. So, and even sometimes with our extremely young population, the reliance on juice. So we created 2 new documents. They're on our website. They'll be linked on the slide here. That one is focusing on the kids under 5 population, so that parents understand how much water, how much milk, and how much juice the kids really should be having. And then the other document is really more focused for a middle school, high school population to increase their knowledge of how much sugar is in the beverages they're drinking and encourage them to sort of have that autonomy to choose water as their drink. So we're excited about those materials, and those are going to be available for anyone to use whenever you'd like. So with that, it kind of goes right to what the next slide here is, that we've had some requests over the years for materials that we've developed. And oftentimes it's become really burdensome to decide, okay, well, this organization wants, 100 of these flyers and this one wants 50 of this magnet. So we're setting up a clearinghouse sort of page on our website that will be available probably in the next 2 to 3 weeks. And we'll be announcing that in our newsletter, where any community organization who's doing this type of work can go in and specifically request materials that either we've developed or we have permission to share from other organizations. And often we'll be able to have those already printed and be able to be sent out. So, if you're from a WIC program and you'd really, really like, 100 of these flyers on pregnancy and oral health, you would be able to just log into our website, request those materials, and we will have them shipped to you. As often as we can, the materials, of course, will be offered as we have funding for them, free of charge, and we'll just be relying on donations and grant support to support this project. So we're really, really excited about this materials request page, and hoping to announce that, as I said, in the next 2 or 3 weeks. So the last thing that we really tend to work on around our priorities is the connection between oral health advocates in our state. So again, we don't do this work alone. We can't do it in a silo. We rely on so many different groups to collect ideas. And it also allows us to do more advocacy. So we wouldn't be a very good health coalition if we didn't do a fair amount of advocacy, specifically, working with the legislature, working with the administration. And we publicly support a number of proposed policies. So when we look at things like teledentistry, the expansion of adult Medicaid coverage, extension of postpartum benefits under Medicaid to 12 months. We have a number of partners in the state already working on that, and we fully support it. This spring, we were able to support HR 68, which passed on March 24th, which actually directs our state's legislative budget and finance committee to produce a report on issues in oral care in rural communities. So we're going to help supply information for that report, and we really are hoping to see that it might lead to some major policy changes in 2022 and beyond. So, if there's things that your group is working on and you want us to sort of help work together or sign on to those things, we're always open to those types of possibilities. So as we're starting to wind down here, I just have a few more slides to get through. I wanted to give everyone a reminder that if you have any questions, please start typing them in Q&A. And as we wrap up the last few slides, we'll be able to do that. I wanted to talk a little bit about the fact that, as Deb mentioned, we're hoping to see people in person this year, and we're going to be hosting a number of events throughout the remainder of 2021. So we hope you'll consider joining us. As you can see, I mentioned our workforce webinar that's going to be coming up on July 21st. That's going to be to go over that really lengthy inflow-outflow projection model report from the Health Policy Institute. So again, you'll be able to register through the slides that we send to you. And then all of our stakeholder meetings. In a typical year, we would have 4 stakeholder meetings all across the state. So we are still going to have our 2 in the fall, which will be on the western side of the state and central PA. Our Oral Health Summit is typically held biennially. We're a year behind because of COVID, but we're really, really excited about this year's summit. So this is a pretty large 2-day gathering. And the focus this year is going to be on a variety of topics. I think we have 12 different oral health topics we're going to be talking about. And all of our presenters are going to be talking about Pennsylvania-specific projects, which is really neat because so often you go to a conference and you learn about something that's happening in California, but maybe the rules aren't the same here. Maybe that work doesn't apply in our environments. So I'm really, really thrilled to bring the summit this year with a completely Pennsylvania perspective. So the registration will open up for that in early September. Typically, we kind of can book the capacity in this first, few weeks of early bird registration. So I would encourage you all to, if it's to mark your calendars now, and hopefully you can join us. And then we'll do a similar update like today, a virtual update on December 3rd, which will capture the second half of our year and probably recap the summit fairly well. And I threw our dates on for 2022. So that we're hoping to be in a completely normal year, we'll say, next year. And so we'll do our 2 more eastern sites and we'll do our 2 more western sites. So save those dates if those are areas that you're in and you're able to join us those days. So hopefully you can join us for something coming up in the next year to year and a half. So I'm going to ask Amy to put up our other poll that we had for today. We just want to ask you, so we went over a lot of information and we'd love to hear, and we just selected a few, but what major project of PCOH are you most excited about? So when we were talking today about these activities, what really was like, yes, that's the thing I'm excited about. So while we're all answering that, I did want to mention, if that work has you excited, you want to get it more involved. We do run a variety of work groups and task forces. Some meet quarterly, some meet monthly, some meet as needed. And we're really always looking for fresh ideas and voices in the room. So we also connect with a lot of local and regional oral health coalitions and work groups. So, if you're in, say, Perry County, we have a group in Perry County that does a lot of really great oral health work. And I think Cliff's on today, so I'm saying that just for him. We can help you get connected with one of those in your area if there's one nearby. So that's also a big part of our work, is we want people to be able to work locally too. So looking at the poll, got about 2 more seconds. It looks like most people have voted. So we'll go ahead and look at the results of that. And it looks like the basic screening survey and the summit have won. Those are the things that everyone is most excited about. It might be the thing I'm most excited about too. So thank you guys for sharing your ideas there. And we're really excited to be able to work with everyone on those projects. So with that, a couple resources here. Always we have to share some resources. If you're interested in learning more, you want to know more about policy work that's happening at the national level, some of the trends that are happening in oral health. Our resource page is linked there, as well as some of our national partners. So please feel free to check those out because they will give you a lot more info if you need it. And the other thing is, on our website, we do have an online calendar that we maintain during non-pandemic times. It's really chock full of meetings and conferences. We put national ones on there as well. And so if there's, hey, I really want to learn more about something, that's a great place to check. And we're starting to see an uptick now in in-person events. So make sure you bookmark that site on your browser and check it out often. We also maintain a strong social media presence. So we've got updates that aren't always included in our weekly newsletter. So when you get the slides, you're going to be able to click on each of those logos for the social media sites, and you can then like or follow our pages. Lastly, we do participate as a charity in the Amazon Smile program. So if you're not familiar, you can actually select a charity of your choice that receives a donation directly from Amazon equal to 0.5% of all your purchases. So you can make PCOH your charity of choice. It's my charity of choice, and I'm happy to say that I believe we've received over $100 from my purchases over the last 2 years. So that tells you a little bit about my Amazon spending. But that really wraps up sort of the informative portion of our webinar update today. I do want to allow a few minutes for questions. So let's check a little bit here and see what we've got going on. And I know that, let's see here. And I know Dr. Greenberg shared a report about dental fluorosis. And Dr. Greenberg, I would love to tell you that I had read that, but I wasn't because I was getting my slides prepared. So I did see it come through though, and I'm looking forward to diving in. So it might be something we can share maybe in an upcoming newsletter with everyone. I will say that if you are someone who hasn't been receiving our newsletter in the past, typically we add anyone who joins a stakeholder meeting or a virtual update to our list. And you can unsubscribe at any time, but you will get our regular newsletters. We don't overwhelm anybody. We try just to put a couple key things in our newsletter each week, something that you can look through and be done and clear out of your inbox within 5 minutes, usually, I would say. That's always our goal. So I don't know about you guys, but inboxes are, the bane of our existence anymore. So we don't want to burden anyone with that. So any other questions that are coming in? Anything else? I know we've captured a few of the questions in there. Let me just make sure that there's nothing else coming in. Okay, I'm not seeing any other questions pop in there. So I do think that will wrap us up for today. I do want to just say thank you, of course, for your time today to learn a little more about PCOH and our work and what we've been up to this year. And really just thank you for your passion in improving oral health for Pennsylvanians. I really, really mean it that we cannot do it without each and every one of you all to serve as these champions for our communities. So, definitely stay in touch. Make sure that, you share what you're doing and share what you're learning. And, make sure that we can help you with anything that's going on. We're always happy to connect, even one-on-one. So if you just want to schedule a half-hour meeting with one of our staff just to chat about something, that is what we do. That's what we're here for. So that should wrap us up for today. I don't see anything else popping into the questions. So thank you guys so much, and I hope you have a wonderful rest of the summer.